Our first month we made about $10,000. Last month we made about $20,000, and this is added income to what we've already been doing. This one device has changed my life and the life of so many patients and clients that we help. Everybody who's gone the distance in our protocol have had remarkable changes and are happy with their results.
I'm going to reintroduce you again, okay? Dr. Sherra Conde, the Clinical Director of Spinal Line Center in Georgia. So, right here, Dr. Conde, go ahead. Tell us what you do and the services that you provide in your clinic.
Okay, well, I am a board certified licensed chiropractor. I've been practicing chiropractic for I think 15 years, give or take. Well, who's counting? No. So I've been in practice for quite some time. So I was focusing on wellness, family practice. We worked with patients who were involved in motor vehicle accidents that sustained injuries for like whiplash or bulging disc or disc problems and herniated disc, and specialized in helping those patients get well. And I think we did a pretty good job for the services or technology that was out there. And we recently acquired the Subzero and have been really changing lives and changing my life. So I know it's been able to change others, but I'll dibble and dabble in that. So I started off as a chiropractor. That's my background. I got really good at helping people get out of pain quickly, which is what I always wanted to do, is to help people get better quicker, faster, and recover faster than the traditional ways of waiting 6 to 8 weeks for an injury to heal. So we started to do cryotherapy for pain relief using the Subzero and got really good results. And then after we were doing that, I started to get into the aesthetics portion. And that is what kind of, I said this before, that kind of sparked some like life into me, because it was a passion of mine anyway to get into the aesthetics world. But to see too how this one device has changed my life and the life of so many patients and clients that we help has been remarkable, to say the least. And it's changed my life for the better.
Yes. Yes, and a lot of people can speak to that, not just you, not just me, but a lot of our patients and also other Sub-Zero cryotherapy owners. So, Dr. Conde, how does cryotherapy help patients with chiropractic?
Well, um, so can I tell you like the protocol of what I
Yes,
do first?
of course, yes.
So the first thing we'll do is we'll figure out what the patient's needs are. Okay, so that's done with a consultation and an exam. And after the consultation and the exam, I come up with the best form of treatment, whether it's a soft tissue injury, whether it's joint mobilization, whatever it is that I feel that we need to do to get the patient recovered faster, we start implementing a treatment plan or protocol to get them better. With chiropractic, typically what I do is after the exam consultation and then I set a treatment plan of how we're going to treat this patient, I start to use the Cryo first for inflammation and pain relief. Most of our patients will come into our office from being involved in a motor vehicle accident, and it only requires or take 5 miles per hour to get a whiplash.
Mhm.
And these injuries could cause damage to the disc, herniated disc, bulging disc, slip disc, prolapse disc, can cause damage to the disc. And if you can stabilize the joint and stabilize the spine quicker, you're less likely to have these injuries that will turn into like chronic injuries. So it only takes 2 weeks before scar tissue starts to develop clinically when you're involved in a motor vehicle accident. So if you've been involved in a motor vehicle accident and you're not under care or receiving some treatment, 2 weeks later, your body's already started to develop scar tissues and adhesions, which starts the process of declining the spine quicker and rapidly than if they were to use some form of um, treatment through chiropractic, which is for joint mobilization and to stabilize the joint, but also too for the with the cryo, which helps to get the soft tissue, removing the inflammation from the trauma to stabilize and lock the joint in. Is how you're able to help patients get better much, much faster and to minimize the chances of this turning into a permanent injury.
Yeah, that is the same thing. All that knowledge came from my chiropractor. I actually had a motor vehicle accident back in July.
Mm-hmm.
So me owning a Subzero cryotherapy device and doing chiropractor at the same time because I have some subluxation right here. I had a whiplash. So my chiropractor was telling me like imagining like I had cryotherapy almost every day because I have access to it.
Mm-hmm.
So that helped with, like I was explaining to them earlier, when we are exposing ourselves with the cold therapy, what happens is that cold therapy constrict the blood vessels and it alleviates those inflammatory chemicals that decreases the pain. So me as a Sub-Zero cryotherapy owner and I was in pain. Imagine if I didn't have Sub-Zero and I was going through that pain. So I'm glad that I had that access, but I also went ahead and made sure that I was seeing my chiropractor
Mm-hmm.
right away because, like you mentioned, the scar tissue form, you said it's 2 weeks.
Mm-hmm.
It's so
2 weeks.
fast, yes. And then when we are older and we don't take care of that, when you don't see chiropractor while you're going through
Yep,
this,
your body
what
turns to arthritis. Yep.
tell us what
Yep.
happens. If you get into an accident, you don't do chiropractic care, you don't do cryotherapy, and you just leave it. What happens when you reach 50 and 60?
Well, it starts the degenerative process in the spine, and that breakdown process will continue on until there's damage to the disc, there's damage to the vertebrae itself, and those vertebrae now start to build more calcium deposits on those ends of the vertebrae, so start to fusing together. Now you have degenerative disc, which if you don't treat it or try to prevent it from getting worse, it starts to deteriorate much faster than had it been left alone in the first place or not damaged in the first place. So a person can have be 20 or 30 years old involved in a car accident, but could have 60 years of accelerated damage because they did not do the proper care to treat or to take care of that injury or to rehabilitate that injury.
Wow. And that could lead to what? Spine surgery later on?
It could lead, yeah. Unfortunately, sometimes people have to have spine surgeries because they either are not a candidate for chiropractic care or they've waited too late and that's the only option that they have. But then they stand the risk of 60% of people who've undergone a spinal surgery, 60% of them have something that's called a failed back syndrome, which means 60% of chance of that surgery didn't work. And within 5 years, they're on the table again for another spine procedure because that segment above or below has to work overtime because of that surgery, and now that causes degeneration in another segment and another, and that's a vicious cycle that we try to prevent. But that's a vicious cycle that happens when a person has undergone surgery. I've never
Wow.
one person who's only had one back surgery and told they were fine. They were always told that they have to go back in and do another procedure. So we try to minimize the risk of that happening.
Wow. Wow, so much gems. Look at that. So much knowledge. Thank you for sharing all of these. Not a lot of people know this. That's why we appreciate you and other providers coming joining us on our America Cryo Live because a lot of people doesn't know about how important it is, not just about cryotherapy,
Yeah.
but conjunction with other modalities out there like physical
Mm-hmm.
therapy or massage therapists or especially like chiropractic care, which a lot of people are very skeptical about it because they don't know.
Mm-hmm.
So a lot of us, education is the key. So having this platform that we can educate a lot of people, I believe that is very important. Do you agree?
Absolutely agree. I think knowledge is power. We have this thing, and we say when you know better, you do better.
That's
And
right.
that's right. When you do know, or even sometimes people think that they know and they're misinformed and don't have the the full wealth of knowledge that's out there, especially for chiropractic. There are a lot of myths about chiropractic, or they're not real doctors, or chiropractors hurt people or cause injuries. A lot of these things have no validity to them, but we've heard somewhere along the line and we kind of ran with that. And so when we get to the platform, just like we're sharing today, where you can dispel myths, you can go and see a licensed chiropractor, not the things that you see on TikTok, because I'm sure that all of that is not chiropractic. Sometimes those things are just kind of gimmicky, but nonetheless, if you go to a board certified licensed chiropractor, you're in good hands because of the amount of school and education that's required. And the state boards keeps regulations really strict. National boards also too keep the regulations really strict. So if you are looking for a chiropractor, those are the two things you should look for: is that they're board certified and that they're licensed in that state. You already know then that they have proper education to know when and when not to administer care and to adjust.
Yes, that's right. So now you know. Let's find someone who has cryotherapy at the same
At the
time.
same time. At the same time.
At the same time when they have that modality. So Dr. Conde, I've seen we have the same some other modalities. You have the red light therapy and you have the vibration plate. Can you tell us what's your protocol when I come in and I'm seeing you? I have whiplash and well, actually, let's do. I know that you do cryosleeping as well. Give me
Okay.
a
Yeah.
rundown of how when after the consultation you see your client and you talk about the goals, the body goals, and we've seen a lot of your awesome videos. And
Thank you.
tell us the rundown when they walk in and they see you. What's your protocol?
Okay. Well, I like to create an experience. So when they come into the office, the first thing is they're greeted really nicely by somebody in my team, and they're welcoming with a nice herbal tea. And the teas are just lymph support. So it's a lymph support tea. And I think that they're not really expecting that, but sometimes they may have a little nerves about being in a place. They're not really sure why they're here. And so that's the process, is just kind of getting them to relax, getting them to feel more comfortable, and also too just kind of like layering on the experience that this is a whole new experience, a whole new world that they've never stepped into, and to just ease them into this transition. So these are some of the things that we do. We give them a tour of our office so they're already comfortable knowing where things are and what to be expected, and then we get to kind of touch on different therapies that they may be interested in, or at least they will maybe create some dialogue about what this equipment does, what does that do. Then they'll sit in a consultation room with me, and then we can discuss like their goals and things like that. After that, we discuss what treatment area they're concerned with and what their body goals are. We bring them into a room where we do our exam. We do an exam, and the exam consists of body weight, body measurements, body fat percentage, and we can do that in just 60 seconds with the shape scale that we use. And the shape scale goes around in 60 seconds and is computerized, all of this technology, all this information in a technology that the client or the patient could walk away with on their app that has all of their information stored. That's a really good tool too, because they get to go home and see themselves. Either they're happy with what they see, or they're not happy with what they see and they want to make a change. So that's kind of like, they go home thinking, wow, I really look like this, because we only see ourselves from the front, not really all the way around. Then we start on the vibe plate. So they'll do the vibration therapy for 10 minutes. We do that to boost a couple of things. One, we know that doing that is equivalent to about 20 or 30 minutes workout. If you just do it on one setting, you can ramp it up, and it will be equivalent to doing like an hour workout, depending on the intensity of the vibration. That helps to start the circulatory system going, which we need that to aid in the lymphatic system and to get the lymphatic system going. And then they'll come into this room. This is my cryo room. So they'll come into this room, and in this room, we'll do, right behind me is a mirror. We get to talk to them about what they want to see or where they want to see improvement with. And you guys know what this thing is behind me. So that's the Subzero. And we start here with the Subzero. So we'll mark their body parts up, which areas that they want. I think that visual is really important.
Yes.
To get them to see what we're working on and what area we intending, and we can sit down to make sure that what they want to work on is the same thing that we're here to work on. And once we mark the body parts that we work, I mark the settings for myself too. How many seconds are we treating this area? How many seconds are we treating this area? And this is for me, but it also too helps the patient know that it is a rhyme and a reason what we're doing. It's not, we're not flying by the seat of our pants, but there's a protocol to why we're doing this. Once we do the cryo slimming, I will sometimes put them on the red light therapy. Sometimes I use our version of the M-Scope, which is for muscle stimulation. It depends on what their overall goals are. And then we go over the results of their scan. Okay. We also, if we're really busy and I need to place them into another room, I might put them on like the hydro massage table where they can relax a little bit longer until we get ready for them. Or even on the red light therapy, because our red light therapy is paired with like a In Harmony sound lounge, which is frequency sounds. It's also helped to get them to a nice relaxation state. And we know anytime we have stress inside of our body, stress levels, the cortisol is going to go here. So we try to do everything we possibly can to minimize stress in this office. That could cause health complications or even unwanted fat in areas like this. And so we go over the results of their scan with them. We go over the results of what we did. We share with them a printout result. We talk to them about our recommendations for them, which treatment plan we recommend based on their goals. And we particularly give them different options. And then they typically like that they have different options, but they like to also ask what are my recommendations as far as our protocol. And I share my recommendations for them, and then we'll get them signed up. So they'll start either like an introduction on their first visit in our office, and on their next visit, which is 1 week after their first visit, they'll come in and start their sessions. And that's it. That's how we do it at Body Utopia.
Yes, that's a whole experience. If you guys have any questions, go ahead and drop your questions down below, and we'll answer that as we finish this questions. Okay. We already have a question for you, Bob. Off topic, but can I be nosy and ask where you got that cover for the 50-pound tank in the background?
This came from Club Cannon.
Yes.
Yep.
Yes.
Probably. Yep. We found them Club Cannon because I don't know. We just found them.
Yeah.
I mean, I think you can get anything. We liked ours because we could brand ours with our own brand. So I saw some other ones too, but this one you could actually get stitched in. So
yes. Club Cannon. That's where I got my cover too. When I travel,
okay.
When I do my content creation, I do cover the tank as well, so it looks more presentable. So yes, going back to what you said, it's a whole. I think it's very important that we, for our clients, for our patients, we give them the experience of the care that we provide, because that's the reason why they come back. Because of the experience and the fact that they feel like, because a lot of our clients or patients, they want to feel like comfortable. So I think that giving them that experience means a lot to them. We have another question. What markers do you use, Teresa? What markers do you use on people's bodies?
Is that a question for me?
Yes, a question for you.
Oh, this is actually it. What I use. It's like a eyeliner. It's makeup.
Yes, and then there's also one on Amazon, Teresa, eyeliner, or the one on Amazon. There's one from Amazon that I bought before.
Oh yeah. Okay. What is that one? Because what I do is I just use a makeup remover to just wipe it off. What is that you have?
I I bought it. It's I forgot. I have to go to my Amazon account and see what's the name, but it's just a random a pen that I've seen one of the body sculpting
Okay.
owner. Yeah, so they
Okay.
have that on Amazon.
Nice.
Cat,
I need to look into it.
yeah, Club Cannons. I believe it's Cannon.
Mm-hmm.
Club Cannon.
Cannon.
Yeah.
Like cannonball.
Yes. All right. New Life Wellness. Can you talk through the facial protocol that you use? Do you use talc powder?
That's a good question because I've seen some other cryotherapy device. Their protocol is using the talc powder. I have never used the talc powder, but I've always used uh, American Cryo's protocol, and I feel like I've gotten really good results with just using whatever their protocol or training is. I don't want to do too much outside of what they've been, taught us how to do and how to use the device. I want to use the device as close to how it was developed and designed as possible.
Yes, I don't use the talc powder as well. Well, our master esthetician, I mainly focus on the cryo slimming, which most of my clients are actually cryo slimming. With the percentage, which one is more of your percentage with clients, the cryo
Body,
slimming or the
the
pain?
cryo slimming,
The
cryo
cryo
slimming.
slimming. Yeah,
Mm-hmm.
same
And
same
we
thing.
get some awesome results. Let me just tell you, I want to brag on this thing because we're getting some really and rapidly. Like we don't have to wait. You can start to see changes even like the first day. The first day you can start seeing change. Like within today, I was working on a lady, and I was working on. She wanted her inner thighs done. I worked on her inner thighs, and I just did the protocol for inner thighs. And I stood back and I let her see from one thigh to another, and within minutes apart, there was complete visible change. And that's what I'm saying. That's how fast it is, so you can visually see these changes. Versus, some other equipment, I think that people get discouraged when they don't see some results. They want to see
Yes.
something to keep going, and these results are just, pretty awesome.
Yes, yes, of course. You want to see results. You want to feel that. You want to see that it's actually for some people you can see result. For some people they don't. It just really
Yeah.
depends.
Yep.
My needs. Awesome. I'm coming in from Cryo Skin, and I just got my America Cryo device today. Congratulations! Welcome to the club.
Congratulations.
All right. So new life on this. Do no other products are implemented during the products. Do you recommend 2 sessions before spreading 1 week apart? What do you mean for the facial? It's safe to or are you talking about cryo slimming? Because I do my protocol is just like pretty much same thing as you, Dr. Conde. I do see our clients every week or within 2 weeks for the cryo slimming.
Mhm. Well, I will be honest, we do way more body cryo slimming than Frotox. But I do it on myself. I've done it on some patients. But for regular routine, I don't know if it's because that's what we're pushing in our office, but the cryo slimming is our number one cryotherapy uh,
Service.
service that we provide.
Yeah, okay. So let's talk about the business side of America Cryo. Can you share us, if
Yes,
it's possible,
yes.
the revenue, the
So
ROI? Everyone wants to know.
okay. So when we first started, I was surprised how fast we were like making money. I was really surprised how fast we were making money. So much I was kind of like, this is kind of scary how fast we're making money because it seemed like it's first of all it's too fun for me to make this much money. It's kind of guilty that you make money after having fun. I know people say that that's cliche, but it really does. How do you make money when you're having so much fun? This is fun for me. So, but we've made our first month, I believe, when we first started, we had already paid for the device, right? What we paid for, we already paid for it. And I was just like, okay, so let's see now, like if we've already paid for the device in the first month, which we did like the least option, and the return of investment, right? So when we started to say like now we really like, okay, let's really get into the saddle and see how we can actually do it. And what we made our first month which was already our return on investment, we've doubled that in just a couple of months. So our first month we made about $10,000 just playing around, and was saying, yeah, and we're selling the plans. And now we're closer to, last month we made about 20,000, and this month we're closing closer to the 20,000, and this is added income to what we've already been doing from our other services. So the bonus is, you know, we weren't expecting to do astronomical numbers right away, but I have plans for this device that is just like, like the sky is the limit. We stumbled upon this device. We stumbled upon this lifestyle of cryo therapy that's been very rewarding for me. But return on investment is definitely there, and it doesn't take long to see. And so when we start to do a couple of other things, you know, there's some people who are doing 100,000 months in cryo easily, and I can definitely see that because we're doing it, not even trying. You do it, not even trying. Imagine when we were like home and shift our focus and attention to doing that. And I think that's possible for us within the next 6 months to do that.
I believe you. I true. Let me smile. I'm just smiling.
Yep, I
Because
think that's very possible. We need to tweak a couple of things in our office, like our, you know, our I mean, not our protocol per se, but we were working on chiropractic certain days and cryotherapy certain days. And then I said, you know, well, it's actually we're doing them all in one and the same day. And then I realized that the chiropractic, although that's very quick, when you're doing like, you know, really intimate with people in a ways where they're, you know, they're letting their guard down to be really vulnerable with you, to share their, you know, body image or body concerns. You can't rush these people to get to the place that you could normally with adjustment. So that's been an adjustment on me to get to the point where I am, you know, meeting and exceeding their expectations as a practitioner without, you know, again, treating them the same way that I would my chiropractic patients who just want to get in and out. They just
yes,
want an adjustment, go home, I'll see you next week, I'll see you next. They're like that. When, like I said, when a person is unrobing or disrobing and they're sharing with you what their body flaws are, if it's their thighs, their arms, their stomach, that's something where you got to kind of come down with them and say, it's a safe place here. This is a no judgment zone, and you can feel safe here and not feel judged and not feel criticized. But, you know, for some people, their whole life, these things have been something that they've, you know, dealt with. And it can turn
yes,
into body dysmorphia, where they have a real psychological trauma associated with that body image. And to see a person who could have been holding on for something for such a long time and start to get better with that, it's very rewarding, first of all. But it doesn't take long to start seeing transformations. So their mood is better, their confidence starts to boost. They start to do things that they haven't done in a while, and it doesn't cost them $20,000-$30,000 to do this. You
yes,
know,
yes.
it doesn't cost them $20,000 6 months in and out of post care. Like, they're getting these results relatively quickly and back on with their lives.
I the miracle that we see every single day. I'm a registered nurse, and I left bedside care 15 months ago. And what I do now is what I do now full time. And American Cryo Subzero device have changed my life as a single mother and as a registered nurse. For me to get out of that comfort zone of me being a nurse for 15 years,
Mm-hmm.
that was not easy because I know that that's what I've been doing. So taking the leave of faith and putting everything that I have for me to start a business, and starting from nothing pretty much, and
Right.
now here I am. And even though I am not working directly with patient bedside, I'm still seeing that feeling of I'm seeing I'm seeing progress. I'm seeing
You
results.
changing lives, right? You
Changing lives.
I mean,
Yes,
these things, see, the thing is, when we have a clinical background, hands-on with patients, they don't necessarily prepare you for the psychological every single time of what can happen when you change a person's physical appearance.
that's
It's
right.
almost like you're taking off a layer of something that does not belong to them. I'm not shameful, or I'm not unhappy, or I'm not depressed, or I'm not, embarrassed. Like, these are layers that they put on themselves.
Mm-hmm.
And, like, it could be from a bad marriage. It could be from whatever it could have been.
Trauma,
Like,
yes.
these people are grateful. They're better off today than they were a couple of months ago. And we put them into a better space. We help to put them in a better space,
That's right.
because it was somewhere along the line they associated their body their body image with unhappiness, with misery, with whatever it was, but they've associated with that. And to help a person feel good about themselves, I mean, that's really priceless.
Yes,
You cannot put a dollar amount on helping a person heal from the inside out.
that's right. And the fact that I feel like we're not just business owners, but also
Yeah.
we become like a safe space for them. And I feel like I'm a therapist sometimes. I don't know if you feel the same way, but
Yeah.
giving that opportunity for me to be able to listen and really be there, because weight loss and fat loss, these are not easy. A lot of people are going through a
A
lot of
lot.
this, like you said, this body image because of the things that we've been through. So
Yep.
I think being in this space of this what we do
Yep.
is truly a blessing for as a healthcare provider. So
Yep.
I'm thankful for knowing that you do that. I truly feel that you do love your patients. Your patients there are so lucky to have you. I can feel that energy, and it
Thank
really is.
you.
This frequency is very, very important.
Yes.
So we
But
have
that
some few questions.
I
Go
was,
ahead, Dr. Conde.
I was gonna say, it goes both ways though, because they really pour into me the same way.
Mhm.
Like, it's a love thing. Like, the way I love on them, they love on me the same way.
That's right.
So,
That's right. All right, let's go ahead and answer a few questions. We have Cryo Alchemy. What's the protocol you guys have for athletes? How many sessions do you recommend for those suffering from injuries or chronic pain? Chronic
I
pain.
take that. Sorry, what was the first part of the question?
The first part is, what's the protocol you guys have for athletes?
For athletes? Okay. So, um, sometimes with the cryo, for them, they need to be seen a couple of times a week. So I may use the cryo on them first, but I do also the adjustment. So I do not just do that. Now we can do the joints in any part of the body. If it's the ankles, if it's the knees, if it's the spine, whatever joint it is that needs to be adjusted, we can adjust those areas. But I'll do the cryo first. I think is more, my opinion, beneficial to reduce the inflammation in the area so that the joint moves easier and is more comfortable for them. So I use the cryo for that, which I've used a form of cryotherapy for a long time, and I found the benefits of that. I would tell patients to ice, go home with ice, put ice on this, and they would say, not heat, because my doctor told me heat. Well, other doctor, and they were always confused. But I knew, again, what happens is when you have an inflammatory response to trauma, or a nerve root is inflamed, the best way to get rid of pain quickly is to ice. But when they put an ice pack here on the neck or the shoulder, it doesn't penetrate the same way it does with pressurized the CO2. So that icing on an ice pack, or with the ice pack, doesn't penetrate deep enough to get into that joint to move that inflammation. So for years I told patients to go home and ice, and they felt some relief, but they're doing it much faster. Like, they're walking away going, oh, yeah, I don't feel anything at all. Do that again, because they had suffered for such a long time.
Yeah.
And to see them now doing the things that they used to do, and they're surprised at how fast it worked. They're surprised at how fast they're no longer dealing with that pain. That is the real change. Game changer is when they don't have to suffer as long as something that they used to think would take forever. Or I've been dealing with this for years, and you mean to tell me that little thing happened in a few seconds and I'm no longer in pain anymore?
Yes, yes. That's how
Was it
quick
just
it is. No, that was perfect. That was too quick. Like instead of doing like that the ice pack for like I remember when PT was always saying like do it ice pack seven times a day.
yeah,
And then so it's like I had an ankle sprain 7 times a day, but with cryotherapy, it's like what 2 to 3 minutes.
yep, yep, yep.
Mhm.
That is so. That's the thing too, because when you have um, like experience that we do in seeing patients, like clinically, you do whatever you can possibly think of to help a patient, right? And
Mhm.
you just want to do your best and do no
Yes.
harm. But when you can see one device is working much faster than another, you're kind of blown away because you know that the science of what happens with cryotherapy, you just don't know the device can make that more beneficial. So
Yes, that's right. Cryotherapy and then red light. That would be beneficial for your patients or clients or athletes who are suffering from injuries or chronic pain. Protocol for head injuries, concussions, sports injury. I don't do the head injuries, concussion, sports injury. Do you have experience with that, Dr. Conde?
yeah, I do. I know that most of the time when you have like a head injury, the upper cervical region in your spine takes a big toll on that. So the occiput and the atlas, this small little joint has a lot of different nerve endings, like the vagus nerve comes from here, which can subsequently affect the whole entire body, from balance, equilibrium. All of these things can happen. So for me, with adjusting in this area, the upper cervical area, we can really good benefits from adjusting that. But I haven't had a patient to come into my office since I've been using this device to do any head traumas to give them relief. But I'm sure it's the same thing because you still have the soft tissue in this area that you want to reduce the swelling on rapidly.
Mm. Wow, I'm learning. Look at that. So much knowledge. All right. Are either of you doing post-op clients? Sorry if you mentioned it. I had to check out a client. Post-op clients. Yes, we do. I do me first, Dr. Connie. So I do see a lot of post-op clients for hip surgery, liposuction. 12 weeks after lipo, we do the cry slimming and the Brazilian lymphatic massage. And we know that after liposuction, Brazilian lymphatic massage really helps removing those, those toxins and making sure that the lymphatic system is working very well. So we do post-op for that. How about you, Dr. Conde?
I have I have had patients who were considering coming in for post-op. I think again, what we talked about, education is really important. Like we definitely don't want to do anything outside of the doctor recommendations
That's
first,
right.
right? So whatever the doctor has recommended when they're under their care, but with the cryotherapy, adding to that helps to speed recovery up.
That's
We do
right.
know that we know the science that's there, but when I've had a patient who called and inquired about that, but I mean I couldn't take her on because she hadn't had a clearance yet.
Mhm.
But what I would do is once she's cleared, we work with her doctor to give her faster recovery and so she can get the results that she wants, because you can lose your results if you've done any type of cosmetic procedure. You could be unsatisfied with your results if you don't do the proper post care treatment.
That's right. So it's very important, like what Dr. Conde said, that the doctor, the surgeon is on board giving you medical clearance before you do anything, especially with, I know that we know, like you said, the mechanism of action of cryotherapy, especially with these healing benefits of it for post-op. So it's important that we get the clearance first, the consent form, the consent from the surgeon before we do any type of treatments to make sure that we safeguard ourselves for whatever that could happen, right? Okay. So
Absolutely.
how many inches have you seen the average person lose?
Inches is a really good question because I've seen
Mhm.
patients lose pounds.
Yes,
I've
pounds.
I've seen patients lose pounds.
That's right.
Miss Annie is a patient. She's 70 years old. She doesn't look it, by the way. Miss Annie came into the office and, she wanted basically a new leash on life. We did her. She told me that she lost 20 pounds just doing cryo slimming in 8 weeks.
Yes.
20 pounds. Now, she came back in to tell us that story. I don't know if how much she's lost since she came in, or that was like her jump start, which I'm sure it was. But she lost 20 pounds in just 8 weeks, which she didn't come in to lose the weight. She came in to lose the inches. So she lost the inches and the weight. Um, the amount of inches, to be quite honest, I'm not sure, but everybody who's gone the distance in our protocol have had remarkable changes and are happy with their results.
Mhm.
And I started to notice too that we could adjust the amount of sessions depending on what a person like needs. I don't want to just say it's me because I know it's the device that's doing it, but I feel like taking credit for carving out some like abs that women were like, oh my God, I couldn't see my abs. But it's not me. It's definitely not me. It's the device that's doing it. It's definitely the device. It's the Subzero that's doing it. But I would say that I'm rooting for them too. So maybe me kind of pushing for them to,
Yes.
hey, let's get these results is kind of why they're doing it too.
Yeah,
So
and I think that what our clients are being when they like you said jumpstart. I always say this is just a jumpstart. This is just a
exactly.
supplemental to what you are gonna do when you don't see us on the days that you're not here at the clinic, right? So what are you doing to make sure we incorporate strength training, walking, mindful with what you eat, and I think they become more like mindful to what they're
Conscious.
doing.
That's
Yeah, conscious about what they're eating,
right.
conscious about being active. And I think that right there is what they really need. Just a jumpstart, just a push, just that motivation and the support.
Mm-hmm.
And that's why we're seeing a lot of results. So,
Mm-hmm.
yes.
Yeah.
All right. What else do we have? Can it help with the stroke recovery? That's a great question.
I think that's a good question for me
Mm-hmm.
because I had a stroke, okay, and I had a brain injury, started from a brain bleed, and this happened a few years ago, but I remember recently, that was just yesterday, Jamie Foxx did his special, and in this special, his Netflix special, he talked about what happened with him when he experienced the stroke and the symptoms. Like, there was no known reason why I had a stroke per se, unless it was family history, because I had two people in my family, actually three people in my family, who had a stroke. And so it could be from genetic hypertension, it could be from stress in your life, or whatever it was. And they still perplexed because I wasn't overweight. I didn't have a bad, poor diet, and I was still exercising. But clinically, the only thing that was left to think about was that it was due to genetics. Now, when I had the stroke, I had no knowledge of cryotherapy. Let me just be quite honest, okay? I had no knowledge of cryotherapy. What I did have knowledge of was that the body has an amazing ability to be able to heal itself. So what I gathered as close to me as possible was tools to help my body heal better. So when I was as a chiropractor, I've seen a lot of people get better and me my own healing get better. But I knew this was very specific because it was due to brain trauma, and my brain had to heal. Okay, is my brain still healing? Yes. Does my brain ever stop healing? No, it's going to always constantly be healing. And so what I use the cryotherapy for is I use the uh,
Wow.
I use the fog, okay? And I use that because it is a therapy for me that just brings a sense of de-stressing from me. And I know that when you're under stress, the muscles tighten here, the muscles pull up here, and all of these important nerves and blood vessels and blood supply can be compressed when you're stressed. And you know, we don't have any stress in our lives. Look at us, business women, taking care of people with health care. We don't have any stress, right? But we know how to combat stress and how to minimize the amount or the impact of stress. We want to minimize the amount, the impact of stress, and to do those things. So for me, cryotherapy is right up there with like exercising, with eating right, with having a positive mental attitude, with chiropractic care. These are my big go-to for self-care and self-healing. Because the cryotherapy, I've seen it. I know the science behind it.
Mhm.
And I know now what this device can do by seeing the power, what it's doing for others. So I haven't had any experience clinically with me saying hand by hand. I've worked on a specific patient who's had a stroke and had those. I can only share my own experience of having a stroke and how my body reacts when I'm stressed out. And I can only say, again, there was no clinical reasons that could have said that, but you know, maybe stress. We were in a stressful time, like COVID. If anybody, which we all have come through COVID, like one of the most difficult times that we would ever witness and see in this lifetime, could go through that and say that they didn't have an ounce of stress, I wouldn't believe them. But
Yeah.
how your body manages the stress and deal with the stress, and you know, like I said before, I'm using the fogger whenever I can because that's my self-treatment. And if I had a patient who had a stroke or post-stroke, I would use the same protocol
Yeah.
for them. I would use
Yeah.
that same de-stressor because of what I know the implications for me and how it does for me. I would want them to experience that too.
Yes, I totally agree. That's what I do too. Fog setting like feels like the endorphins are just being released and it
It
puts
does.
me into this happy, happy
It
mood, right?
does.
Before
It
you
does.
start.
It does.
Yes, before you
I'll
start the
do it.
day.
I'll do it before I see patients. I'll do it if I'm just kind of feeling down. It does kind of give you a little boost of energy. It's like, okay,
Yes.
like I can't tell you like what's happening to the hormones, but I can only, you know, suspect that there's a chemical right there, chemical release with that cryo. It's kind of like, you know, some folks who get into the cold plunge.
Yes.
Like you know what I'm saying? When you're under those sub-zero temperatures, pun intended, when you're under those temperatures, it does do something to release endorphins inside of your
Mhm.
body, which these feel good, happy hormones puts you in a really good place.
That's right.
I mean, and who doesn't want to feel good at the same time look good?
Yes. I completely agree. So for anyone out there who have more questions before we go, we value your time, Dr. Conde. So if you guys have any more questions before we wrap this up, uh, go ahead and drop your questions down below. I know that EST time is almost about 7 o'clock over there. But any message out there, Dr. Conde, to patients who are thinking about uh, first for patients who are thinking about hesitant about chiropractic care and also the benefit of chiropractic care and cryotherapy at the same time.
Oh well. So my office is an extension of Life University, one of the largest chiropractic, if not the largest chiropractic college in the world. And we train a lot of doctors who coming through the ranks of how to be really good chiropractors. So they come to my office, they train for a little bit, and then you know they go wherever they want to go, whether it's Puerto Rico, if it's you know New York. I've had you know just coming from different places, and they train here,
Mhm.
and they get to see what we do is taking a whole wellness approach, not just the one aspect of it, but we talk about diet, we talk about nutrition, we talk about sleep, we talk about all the things that can help a person heal holistically and to minimize as much toxins, exposure to toxins as possible. And doing so, we try to keep them introduced on a healthy regime and keep them that way. and do no harm. I'll say that first. Do no harm. When you're doing that with cryotherapy, I believe it actually aids in on some level of trust too. Because if I'm giving my best clinical recommendations, and if they can see the results happen much quicker, then that builds a relationship with them and a sense of a bond of trust, because now I have a captive audience, but an audience that's already seeing results that I'm telling them is going to happen. We can really go the distance with this person because they can start to see results before they get discouraged.
Mm-hmm.
I mean, it's easy to take an aspirin or Tylenol and go to sleep, but then and feel less pain over a period of time. But we don't have a microscope of what's happening clinically when the byproducts from those chemical reactions enter into our body. We don't really see that. And so when we're talking for chiropractic or for cryotherapy, the two things that we know are natural is chiropractic and cryotherapy are natural. We don't really see what's happening clinically on the inside of the body. Like if we had an invisible, something they can see through the body, what happens when exposed to cryotherapy, we would probably see the amazing cells reacting and behaving in ways that are age defying, behaving in ways that are regenerating and killing off cancer, to be quite honest. When you minimize stress inside of the body, it's proven that the body can fight cancer. It's proven that the body can heal, regenerate, and repair. And 20 years from now, somebody's going to do a clinical research. And this clinical research is going to show the benefits of cryotherapy when you mix it or when you aid it with or pair it with a chiropractic adjustment. These things haven't been able to measure because we haven't had the technology to do that in the past. But I believe things like that were going to be changing. With technology changing rapidly, we will be able to see clinically, scientifically. And I'm not just talking theoretically. I'm talking take a sample of a tissue sample before and after. We will see healthier cells from cryotherapy, and from chiropractic we will see healthier cells inside that person's body because of what we're doing. Mark my words.
Okay.
Mark my words.
This is gonna be all over the internet, so we'll come back to this recording right here.
Mark my
Yes.
step of improvement. Doctor approved. That's
Yes. Dr. Conde, go ahead and promote who you are, what you do, your brand, your business. And I'm really looking forward when I visit Atlanta again.
You
I have
have
a
to.
plan, and God will make his way for me. So
Have to.
yes, I trust God that what he's doing for me is what's gonna happen. So
Amen.
go
Amen.
ahead and promote. I can't wait to visit your clinic and experience all the services that you provide.
Thank
so that I can.
you.
You will probably have to do a live in
Oh, that would
person,
be
like together.
awesome.
That would be great.
That's
So,
powerful. Yeah. So
yes.
okay. So my office is Spinal Line Center, and I said before we were in Atlanta for 15 years. We moved to the suburbs of Atlanta, and now we're in Fayetteville, the beautiful city of Fayetteville, servicing Fayetteville. We're servicing Riverdale community. We're servicing College Park community. All of these are counties very adjacent to us. Henry County as well. And we're serving them with holistic care, with chiropractic care, with red light therapy, and all the benefits of red light therapy, all the benefits of cryotherapy, including powerful cryo slimming and cryotherapy, local pain relief, and even cryofacials. I'm not doing as many as you're doing with the facials, but we've had people who have a more youthful appearance and tighter skin because of the cryo. We're doing in sound, well, it's called in harmony, which is sound frequency, and that's a healing, vibrational healing that works with sounds and tunes and frequencies. We're doing that. We're doing what else are we doing? Weight loss protocols. We're doing For a long time, we were treating patients with neuropathy. And neuropathy is a degenerative nerve, and it's very, can be very debilitating. We were treating patients with neuropathy because of that. We were doing, did I mention everything we're doing? Muscle building with the M scope. We've added that on recently. I mean, we got like a lot of different things. And I think the most important thing, and I know we're kind of wrapping up with time, is the most important thing is when I pledge my oath to do no harm. I pledge my oath to be able to do as much as I possibly can to help my community. I believe that God put me here to help my community, which means that I have to keep up with technology. I have to keep up with times. I have to keep up with things, and I have to invest in my practice. Like God gave me this practice to help others, so I have to invest in my practice with new technology, with new tools, with new therapies, and not get like lost by the wayside. It's important for me to invest in my practice to help my community.
That's right.
And this is a small investment that yields a great reward. So I just want to say that if anybody who's worried or concerned about if the investment is there, I mean, if you're going to make a return on your investment, if your patients are going to appreciate it, the therapy, they absolutely will. If they're going to get benefits from it, they absolutely will.
That's right. And I think um, providing value to a lot of our clients and our patients, I think if that's the goal, kind of like when you're in a marriage, in a relationship, and your first thing in your head is like in the morning, how can I provide value to this person? If that's the mindset that we have every day, how can I bring more value to my partner or to this patient right here in front of me? I think if that's the mindset, it will just speak to itself how your clients, your patients are just gonna keep coming back to you or bring people to you. Because that's what I've been seeing. I feel like, yes, we are running ads, we are doing all of this, but actually the best marketer out there are your existing clients. So treat them well, the word of mouth, treat them well, make them feel home, treat them with so much respect, like you mentioned, because it will speak itself of how much not we're just talking about the finances side of it as business owners, but also the results it's there.
Yeah.
So if you if you guys are skeptical about purchasing the device because you feel like it's not possible, it is possible. And based on your testimony, Dr. Conde, and coming from me, who's a single mom with 2 kids and leaving bedside care, it is possible. And if I could just share numbers with you, I would, so you guys can see that it's possible. I've been full transparency. My clinic is running 30K a month with the Cryo Slimming, and
Let's go.
yeah,
That's
so
awesome.
it is possible. It is possible. You just have to invest and take a risk and really really believe in yourself that you can change people's lives. So
Everybody that who's poured into you, I know that person is better because of what I'm seeing every day. So the 30,000 a month, like, is huge, but it's like what you really get is to change a person's life, and as we said earlier, that's priceless. Like,
yes,
you know, what the doctors are making, or the people who are using the device, what they're making is nothing compared to what they're are pouring into, and the lives that they're changing. And the fact that you get to make money doing it, it's just like, wow,
happily, yes,
am I supposed to be
happily,
doing this? But yeah,
yes,
I think if you're looking at it from the twofold, because I have a business, mine, and then I have my heart gets into the way of wanting to help people. And like, these two things kind of always clash with each other. But when you're doing this, I found a way that they don't. Like, I don't worry about the money, because the money is
it's
definitely there.
there.
I don't
Yeah,
I don't worry about that. I don't worry about, if they're gonna get the results, because they're getting the results. So I'm just like, okay, great. They just need to see for
yeah,
themselves. And sometimes they can see the results on their first visit, and then sometimes it takes them a couple of visits, but definitely if they stick to what the recommendations were for them that they agreed to, they always feel better at the end with their results. And then that's why we tweaked a little bit what we were doing. Like and this is something that's probably for another day, but we tweak a little bit about what we're doing, so patients can experience cryo slimming.
That's right.
Right? When they experience the cryo slimming, and I give them realistic expectations that everybody won't see results right away. But if you are lucky enough to see it right away, great. But if you understand that sometimes it takes time to see the results that you're looking for, then take time, but you'll get
Yes.
there.
Yes, and also I think that that motivation from us and that we track the progress, I think that's very important. So they feel like, okay, you're on top of what I'm doing, and they're feeling the results too. So I think that's very important. One more question before we go. How many CO2 tanks do you keep in your office? I do keep about 50 pounds. I do about 9 or 10 50 pounds tank, because we see a lot of clients a day. So I make sure that we have that. It really depends on the week. I know that this right here, this season of the new year, new me coming in, it's gonna be a lot of clients because a lot of women wants to be in that good, confident physique, or want to just fat loss. So that's what I do. I have delivery every Tuesday, so about 10 tanks a week.
Well, I have 6 tanks. 2 are visible, then there are other 4 behind the screen that are the same size as this. And then I have 1, 2, 3. I have 4 of the small tanks, which is equivalent to, so that's 4 of the small tanks are equivalent to 2 big ones, right?
Mm-hmm. Yes.
So,
The 20
so
pounds
then
and the 50
so then
pounds.
this will be 1, 2, 3, 4, 5. This is 7 tanks. This will be
Yes,
7
yes, pretty much.
tanks.
Yeah,
Yep.
we can see. And also to a lot of business owners out there, just wanted to share with you guys about the abundance mindset. I hear a lot of one of the things that our pastor actually talked about is the abundance mindset. You can't have what you already don't have. And having that mindset, that manifestation for someone like me who's an immigrant and a registered nurse who moved from the Philippines and here now and a business owner, I know I'm going to be a business owner. So I believe I had a conviction that I'm going to be here and helping people, not just bedside care, but doing what I do now. Manifestation is internally shifting your mind, that you don't have to depend on the physical change because you already believe that there's so much abundance in you and God will always provide. So that
Always.
right there, when you give so much to your patients, your clients, that I don't even worry about the CO2 tank anymore. I just know that this is the protocol I'm gonna do. And if they have like aches and pains on their back and their neck, I'm just gonna go ahead and spray. When you have that abundance mindset, it will come back to you. So
Absolutely. Every time.
every
I
time.
think so. Changing the mindset is first. There are a lot of people and thought leaders who try to help people change their mindset by doing that, but that does take some time depending on where you grew up from. Like me, very humble beginnings. I mean, you also too very humble beginnings, but when you have shifted your mindset of abundance or of opportunity of growth, you really will get what you are sent forth. And I've seen it so many times. Like I've had a lot of money, I've lost money, I've had a lot of money again. So it's like it can happen, but at the same time, you know that even if you fall or you stumble, you will get back up.
That's right. That's right. That's the word out there. So thank you so much. That's a wisdom. Wisdom, you don't get that. You have to experience a lot of
Experience
things in life
it.
to get
Experience is
that.
the best.
So
Amen.
experiences teaches us. So thank you guys so much for joining us. It's been a very, very knowledgeable um, live with Dr. Sherra Conde. It's so
Thank
nice
you. It
to
is always a
someone.
pleasure.
Thank
I
you.
always
I
feel
cannot
I
wait.
always walk away feeling um very thankful that I met you. I always do.
Thank you. Thank you so much. And I cannot wait to see you in person. It's gonna happen. I know it's gonna
Yeah.
happen. It's just a matter of time. So I can't wait to do more, hopefully in person in Atlanta, my favorite place. So I cannot wait to go back there. But thank you everyone.
Thank
Thank
you
you, ladies.
guys.
If you have any questions, go ahead and just comment on this live. We're gonna post this on America Cryo, and I'll do my best to answer your questions. Dr. Sherra Conde, Teresa, I will, what I'm going to do is I will share the profile of Dr. Conde. She was asking for your website, but I'm going to go ahead and share that with you, Teresa, so you can talk to her directly if she wants to connect with you. But if you
Okay.
have any more questions, go ahead and we'll repost this live, and then we'll tag Dr. Sherra Conde. Go visit us, americacry.com, for your Subzero. If you are still thinking about Subzero, there's no point of thinking. Just do it.
Just do it.
Just do it. Just
Life.
do it. Just get it, because you're gonna change your life,
And it's on
and you're gonna change.
sale. That's
And
even
huh?
and it's on sale. The reason
Yes, yes. So go ahead. I mean, no time to think. This is the best time to invest for yourself for New Year 2025. It's all about abundance. It's all about getting that bag, and all about paying it forward also to a lot of people around you.
That's
So
right.
thank you so much,
Thank
Dr.
you
Conde.
guys.
I'll talk to you soon.
Thank you guys.
All right. Have a good night, everyone. Bye.